All right, let me get to y'all. All right, what's up, everybody? Only got one in right now. It's all good. Going to get to the information. So I've been seeing, as I was mentioning a little earlier, I've been seeing the comparison for the flu numbers in comparison to COVID-19. I hope some of y'all may have seen part one when I just kind of broke down. We just recently got some good news from from Neil Ferguson. He's one of the renowned epidemiologists who actually at one point, I'm just sharing a little information before I get into part one so I can segue into part two. So he basically did one of the original models that Great Britain used to kind of start their social distancing, and the model that he showed at the beginning, when with no testing and things of that nature, with no vaccine or remedy in sight, he projected that there might be, for example, 500,000 deaths in England alone. And his new model, taking in the fact that they now have scaled up testing, he didn't factor in those who may have already had it. So he got the model and he moved it down. But the big thing that's going around right now, moved it down. So basically, and from what I understand, England has downgraded this infectious disease to a lower level. So that's good news as this thing continues to progress. But in addition to that information, what's floating around now, and I just wanted to give people some information on some scientific information. As I said, why I love science over politics, because the stuff I've been seeing today has kind of been sent out politicized, but I just want to kind of share with y'all what's happening with the doctors and the scientists in reference to this. So the big thing that's floating around now is the idea of how many hospitalizations that were caused by the flu, I guess, since October, based on the CDC numbers. And so people are, and if you've been following me, you know I really have a certain disdain for this flu and COVID comparison, because it's not apples to apples. It's definitely apples to oranges in reference to how this virus is responding, and still no type of remedy. Like, that's the huge difference. Like, as much as the flu numbers can go up and down, we have a way to deal with it. It's called an endemic, whereas this is a pandemic spreading around the world with a novel virus, brand new, that we're learning real time on the spot how it works. And so anyway, I just gave you some good news in part one. I just reminded you of the good news that they got models and more information is coming in, more data points are coming in. So things may be looking up. But I do want to, again, address this comparison to the flu, which, again, I think is not smart based on what I'm seeing from the scientists, from the doctors. But here's the biggest difference for those who have seen those who are politicizing the flu numbers, saying I think there's 62,000 hospitalizations that have happened, I think, since October of last year. I think that's the number I've been seeing. And so people are putting that and are not researching what the difference is. So here's the difference. You can't just go by that number alone. Again, this is not an apples to apples comparison. The biggest issue for why our hospital systems are being overwhelmed is about 5% of, since we have no remedy, since we have no antiviral drugs, about 5% of those who are coming down with the COVID, but while most people are, is mild symptoms, most people are recovering, about 5% of those have to go to ICU. So it is the ICU number that's creating the stress on the hospitals. So, for example, I'm in Atlanta, Georgia. I just heard a day and a half ago, for example, Albany, Georgia, which is, they're out of ICU beds because of their COVID-19 patients. They're literally out of ICU beds. So the issue is not just the number of hospitalizations like the flu, like the people that are putting that number out. Unfortunately, it's the 5% that are requiring ICU to recover in order not to pass away. I still tell people the actual deaths, even though that number keeps being shown, the deaths itself are not the issue to the scientific community. It's the projection of what it would have been had we not bought time with social distancing and trying to learn more about the virus in order to deal with the virus. So that number was overwhelming when there was nothing, when we knew nothing about the disease. That number was overwhelming. The science community is still trying to buy time in order to improve the recovery. But unfortunately, about 5% of people are needing ICU in reference to that. Again, most people recover just fine, but about 5% need ICU. So countries are literally being overwhelmed in the ICU area. That's the issue. And not, don't take it from me. Just go watch some of our healthcare providers. If you can go, I just saw a video yesterday from Myron Rolle. If anybody remember him, former football player that's a neurosurgeon now. And I literally watched a video where he was happy to do a surgery for someone who had epilepsy, I think. Yeah, he was happy to be able to do the surgery because he did not know if that surgery, I think it was epilepsy or something to that effect, but he needed to get into it was definitely epilepsy. So he's a neurosurgeon. So he was glad to be able to do the surgery because he didn't know if it was going to stay on the schedule. Like that, this person needed this surgery. He didn't know if it was going to be able to stay on the schedule. So the overwhelm aspect is those who are in the dire straits. Those numbers are what's stressing the hospital. So when somebody floats out, then again, I'm trying to get out of the politics. That shit bothers the hell out of me, just being honest. Just the science of it, those numbers literally do not reflect what's going on with this virus. Again, 5% of those recovering are requiring ICU. So our hospitalization system is being overwhelmed in the ICU unit. Think about the example I just gave you. Albany currently announced, and that was a day and a half ago, so I don't know if they've gotten any now, but a day and a half ago, they announced they were out of ICU. So the issue, even that, is not even about the virus. Let me explain what becomes the bigger issue when we say stress the hospitalization of when we say stress the system. The bigger issue ends up being, unfortunately, if the ICU beds are filled, it's the collateral deaths that can happen due to the beds being filled. So I don't want to wish, for example, a heart attack on anyone, but the last place you want to have a heart attack right now that I know of is in Albany, Georgia. If somebody has a heart attack, our medical system and hospitals are pretty good at, what's up, Ray? Our hospitals are, plenty of people have, my grandfather had 2 heart attacks. My grandmother had several heart attacks. And if they were, she went to ICU for a couple of them were big. But our hospital systems are, I know a long time ago, unfortunately, people didn't recover from major heart attacks. But the hospitals are pretty good. People still, unfortunately, will pass away because of a motor attack. But typically, it's because they didn't get, the ambulance didn't get there in time. They didn't get in the ICU in time. That's typically when people pass now, because our medical community does very well with heart attacks. So my point being is, if the ICU beds are filled, somebody, again, the last place I would want to have a heart attack tonight is Albany, Georgia, where the ICU beds are filled due to COVID-19 patients. So your death certificate will say died because of heart attack, but you could have been saved if there was availability in the ICU. So when people are floating out these numbers just to attack what's going on, and it's coming from a political angle, go research it. That's all I'm saying. Or if you don't have time to search, for me, again, as I said, the reason I'm even doing these videos is just an obligation, in my opinion, to the Mental Dialogue Community Club, just to ensure people are getting the correct information. The information I'm giving you is not politicized at all. This is just the real reasons why healthcare workers are stressed over this situation versus somebody floating out, this big number of that a flu, saying why did the flu overwhelm the hospital system? Because we know how to deal with the flu. And again, so COVID-19 requires 5% of requiring ICU beds. That's where it's overwhelmed. Like surgeries are having to be moved based on what's going on with the stress of the people that are actually ICU. So while most people will recover just fine, I'm not trying to exaggerate the numbers. I'm not trying to make you fearful or anything like that. It's just, I love science over politics. Even the information I gave in the beginning about how England has downgraded the infectious disease to a lower level than it originally was. I haven't been able to research why. The why could be based on how that they've had I mean, England's a smaller country or not, so I'm just saying it could be simply because they have enough testing and have pinpointed where the virus is. If you know with how South Korea, everybody applauds South Korea, and I mentioned them on the last one, but because they were able to get so much testing and identify exactly where it was at, they're able to lock down specifically where it's at and keep it from spreading. So they didn't have to lock down but a few spots. So for the most part, South Koreans are not locked down like a lot of even, and they were at one point they were the second leading country with the number of cases, but because they took it serious from the beginning, and came up with some very innovative quick testing, like literally people could go to the gas pump and get tested for COVID-19, and so they were able to identify in their small country, like that would be maybe, I don't know how big South Korea is, but it's maybe a few states. So just, you know what I mean? It's like, so it's like people are not, in my opinion, well, I should say people are not. I'm just saying, if you get the information from a political angle, it's going to leave out some common sense questions. So again, when I say I love science over politics, the stuff I'm telling you is not coming from a political angle. It's literally, here's what the scientists are saying, and I've been saying the entire time. If all of our government, not just our government, but any of these governments, if they've listened to what the scientists have consistently been saying, then they would have jumped on this and dealt with it sooner. Some of them, and some of them did. And some people will say, well, the scientists are saying something different now. And as I explained on part one, I won't re-explain it here. As more data comes in, we have more accurate information. But and scientists, they love to correct themselves. I mean, literally, the very same scientists in England that caused all the alarm with a original number of 500 potential deaths if nothing was done is now the very same scientist who is correcting and improving his own model says that number may be 20,000. I'm pretty sure that leads to why New England has downgraded what COVID-19 as far as the type of danger that it is. Pretty sure that plays a role. And so for those who are saying, again, I won't reiterate this too much, but just understand, science is not trying to be right. Science is constantly trying to get it right, and the way they try to get it right is to constantly retest, peer review, make new models. They welcome it. So all science says, hey, here's what we think we know now. Let's make a decision based on what we think we know now. But as we get more cases, as we get more data points, if the models, if the things change, or we flatten the curve, we'll make newer decisions then. So it's not that science was right or wrong in the beginning. It's just, here's the best model they could come up with. We have more information. This model is probably a little better. Let's make a better decision. So science is not trying to be right. Politicians are making points for reasons like, to me, again, when it comes to this thing, I'm not trying to over alarm you about what we're doing, but it's a reason why we haven't seen basketball for the last 19 days for the first time in our lives. There's a reason why there are no school kids going to school. Like the last thing I'm going to say about this, because it just kind of addresses, like the people with pushing all this conspiracy stuff, like people that are pushing that this big conspiracy, at least for I'll say within our government, because again, things could be different in other countries, but I'll say for those who are pushing this conspiracy stuff for our country, here's something they never think about. The last 15 years, the wealth gap has gotten larger than it's ever been. Currently, in the world, 10% of the world has as much wealth as 90% of the world. So for those who are pushing this thing as a conspiracy, I jokingly thought about this today because people just, in my mind, don't think it all the way through, or they stop at one point of view to just be critical. So if that is the case, that 10% of the world has the same wealth as 90% of the world, that's literally what the numbers were, at least prior to this stuff happening. That was the numbers. And so that lets me know if there's somebody behind this, they must not be wealthy. The people that are powerful enough to do this must not be wealthy, because the wealthy was rolling. The numbers were only getting bigger. They were only making more money. So to think that there's some group behind this that would put this out, while they're making the most money they ever have. I'm just, again, I'm not even trying to make a big point with that. I'm just telling people, do not think these things through when the real information makes sense. If you go look it up. But if somebody puts up a meme that says, hey, why did 62,000 hospitalizations overwhelm our system? And you stop there, and the person who made it, Candace Owen, has a political, she's, again, I don't mess with either side when it comes to the politics. When I got science that can tell me what's going on, I can see what's different about this than SARS, than Ebola. We've had these things come in the past, but the biggest question that people that are saying something's up with this, they're not even asking the question, what's different? There has to be something different for us to be in the house. Our kids, no kid in the United States is going to school right now. But this is the same as all the others. Make it make sense, man. I'm your boy Montoya Smith, aka Black Socrates. All I ask is that you think.